Today, I'm speaking with Ms. Abigail Schreier, who is a writer for the Wall Street Journal and the author of a recent book, which was named by The Economist as one of the notable books of 2020, Irreversible Damage: The Transgender Craze Seducing Our Daughters. Thanks for agreeing to talk to me today.
Thank you so much for having me on.
So, why did you write the book?
I wrote the book because a woman wrote to me. I had written a piece for the Wall Street Journal on transgender pronoun laws that we have in New York and California now that assign criminal and civil penalties for failing to use someone's preferred pronoun. And I pointed out that these laws are straightforwardly unconstitutional in the United States. And a reader wrote to me, she read this and she said, maybe you'll take up my issue, but I'm a mom. My daughter had no symptoms of gender dysphoria throughout, her growing up. But the gender dysphoria being the severe discomfort in one's biological sex. But she went off to college. She had a lot of mental health problems. And she went off to college, and with a group of girlfriends, they all decided they were transgender. And she started a course of testosterone. And I've had this problem. There are now an epidemic of these young girls who are in a lot of very real pain, deciding that gender must be their problem and very quickly obtaining hormones and surgeries. And she told me that no journalist would take it up. She had written to many journalists, and I tried to find her an investigative journalist who would write about this or at least investigate it. And when I was unable to find one, I finally, 3 months later, I got back in touch with her. I said, all right, I'll look into it.
Okay. So, well, I can tell you that I have had some trepidation about even conducting this interview.
Oh.
Well, it's because this is it's exactly the sort of issue that you can get pilloried for. And I've had a fair bit of that over the last number of years. I mean, I was very unhappy with the Canadian government's language law provision, Bill C-16, and my comments about that caused a whole sequence of chain reactions, I suppose, that changed my life completely. I was concerned at that time that the movement, let's say the political movement, the political ideology that I saw as driving the language legislation, Bill C-16, would manifest itself in psychological trouble for many people. And so I'd read this book called The Discovery of the Unconscious by Henri Ellenberger, and he talked about psychological contagions and documented them going back hundreds of years, as a matter of fact, and I was aware that such things occurred, and it struck me as highly likely that confusion about gender identity on the ideological and categorical front would translate itself into confusion about gender among adolescents in particular who were just starting to catalyze their gender identity. And so you claim in the book that this is a epidemic. And one of the things I'm wondering about is what relevant stats do you have at your disposal? And why language like that?
Well, I actually asked a bunch of, I conducted nearly 200 interviews for the book. And I actually asked a lot of scientists once I had some numbers, what do you call this? What is it when we have a 100-year diagnostic history of gender dysphoria, and it always afflicted boys and men. Okay. And now, for the very first time in the last decade, there has been a giant surge in a different population claiming to be gender dysphoric. It has shifted from onset in young boys and to teenage girls with no childhood history, and it's shifted from men to women. So I asked them, when you have a demographic jump, and all of a sudden they are, as these teenage girls now, the leading demographic. So these are girls who as a population experienced virtually no gender dysphoria throughout history, suddenly being the leading demographic. I would ask them, what do you call that? Is there a scientific term for this? And they would always say, yes, epidemic.
I see. Okay. So in your Wikipedia page, which, well, I read it this morning and it struck me as a place where a battleground was likely occurring. In the book, it says, in the book, Schreier accuses social media of playing a driving role in girls' decisions to identify as transgender, based on the unproven and contentious hypothesis of rapid onset gender dysphoria. She advocates for withholding gender-affirming medical care for transgender youth, a fringe position not currently supported by most reputable medical organizations. Now, one of the things you do document in the book is the rapid move by organizations like the American Psychological Association and the American Psychiatric Association to change the wording that they've used surrounding the discussion on gender identity. Correct?
Yes, that's right. They have changed the wording, but the bigger change, of course, is that they've gone to an affirmative care standard, which means that they no longer apply any medical judgment. They simply surrender all judgment and agree with or affirm the patient's self-diagnosis.
Right. And along with that goes and this is part of what made me nervous about talking to you, and I still probably am, is that as a medical practitioner or as a psychotherapist, psychotherapists are now bound, as far as I've been able to determine by examining the law, to adopt precisely this gender-affirming position. And I believe that that's the case in Ontario. So I don't do adolescent therapy. But if I had a young adult, say 18 or older, come to me who was expressing confusion about their gender identity, let's say, or was gingerly testing the waters to determine if perhaps they were transgender, I believe that I'm required by law to adopt a position that would affirm that fundamentally.
That's right. Yes, a sword of Damocles hangs over professionals' heads now. And what it says is you must agree with the patient's self-diagnosis. Put another way, it suggests that you should begin with the conclusion. Your conclusion must be that this person has gender dysphoria, and then you can, go along from there and start prescribing treatments. That's not how medicine or any other area of therapy is practiced. You don't begin with the conclusion, you investigate it. Now, you brought up my Wikipedia entry. Oh, sorry.
No, go ahead.
I mean, obviously, it's the number of lies that have been put into that. I didn't start the Wikipedia entry; others did, and there's been, back and forth fights with activists and so forth to rewrite it. But of course, I don't, advocate any. I mean, it's not true. I mean, so much of what has been said is not true. First of all, the affirmative care standard, that's the problem, and I don't advocate a particular method of treating transgender people. I don't even advocate a method of treating transgender teenagers. All I'm pointing out in the book is that there seems to be a sudden rise in these teenage girls who are subject to peer influence and social media influence, deciding they're transgender, and there are no medical safeguards for these girls. There's no means right now, and no one determining whether they actually have the correct diagnosis before proceeding to treatment. That's it.
Right. And so I guess the catch-22 here is that if the statement, most reputable medical organizations affirm or put forward an affirmative care requirement, then any position that questions that or objects to it is, in some sense, by definition, fringe.
Well, it's a good question.
I'm not saying at all that your position is a fringe position. It's a matter. I don't see how that can be avoided under the current circumstances, because the laws and guidelines are written as if this is a fait accompli, right? That we understand transgenderism completely and gender dysphoria, and that all the answers are already in. And I don't think that's true for any psychiatric diagnosis.
Yes, I would just say that it is fringe insofar, or it appears fringe, because all the doctors who disagree, and there are many, and they're speaking up all the time, are silenced. They are told that they could lose their license if they don't immediately affirm the adolescent, no matter what her other mental health problems are, and immediately go along with facilitating her transition.
Right. You talk about about the occurrences at the Mental Health Institute at CAMH in Toronto.
Yes, that's right. I mean, you had, Ken Zucker, the truly a giant, and the in the field of gender dysphoria, who actually oversaw the authoring of the definition of gender dysphoria. He was fired.
Right.
He was fired.
Let's talk about Ken Zucker for a moment or two. So, as you said, he occupied a prestigious position in the world of transgender treatment, and I think was universally regarded as the most outstanding and most objective scientist working in this field. I've spoken to him about it on some occasions, not publicly ever, and he struck me as a dedicated clinician and researcher, and he advocated for, and still advocates for, as far as I know, wait and see treatment method based on the presupposition that most children with gender dysphoria who evince an interest in transforming their body to that of the other sex should be encouraged to wait, because if a waiting technique, it's not a technique even, I suppose, if waiting is with sufficient patience, most of the children who manifest these concerns desist. I think it's 70 to 80% of them. A certain percentage, fairly high, come to the conclusion that they're gay. And it's perhaps the case that that's driving some of their early gender dysphoria, confusion about their identity. And Zucker was fired from CAMH and also pilloried in a variety of newspapers and other publications as a consequence of what was essentially his mainstream stance. Now, I believe, and I haven't followed this up recently, but I believe that he was engaged in a number of court battles with the publications that had gone after him, and I believe that he won his legal cases.
He did. They had to apologize, and they settled with him. I mean, they really wronged him.
Yes, definitely.
You've seen that's what happens when professionals speak out on this issue. And of course, when I say speak out, all they're expressing is concern that there is an overdiagnosis here. You're seeing young teenage girls who do not seem to have typical gender dysphoria, nonetheless be immediately fast-tracked towards transition.
Mm-hmm, mm-hmm. So I'd asked you a little bit earlier about numbers. Do you have any sense of how prevalent this is? And also I'm interested in, and I'm sure the listeners, watchers would be as well, rate of increase.
Sure. So in America, it's a little harder to look at, to come up with these numbers, although I'll tell you the numbers that I do know, okay? It's harder because we don't have centralized medical care like they do in Britain. In Britain, where they have centralized medical care, they can tell you that the number of young women being referred for gender treatment has exploded over 4,000% in the last decade. Okay. In America, we don't have centralized medical care, and you don't even need a diagnosis of gender dysphoria to start treatment. You can start a course of testosterone without ever having received a diagnosis of gender dysphoria. So they're a little harder to come by, but here's what I can tell you. In 2018, 2% of high school students said they were transgender. So that's 2 in 100 kids. That's an enormous increase over what was historically the rate of gender dysphoria in the population, which was 0.01%. So 1 in 10,000 people. Went from roughly 1 in 10,000 people to 2 in 100 high school students. We also know that between 2016 and 2017, the number of females requesting gendered surgery in the United States quadrupled. So we know these are the exploding rates. And then, of course, I've interviewed many therapists, and Lisa Littman of Brown University did her survey. And when you talk to therapists, when you talk to parents, you get the same thing over and over. And that is that the leading demographic asking for gender transition is teenage girls with no childhood history of gender dysphoria.
Now, here's a contentious issue. So, generally speaking, for the story of long-term gender dysphoria to be coherent, a girl would have to claim that she'd always known that she was in the wrong body, that she was a boy, and that had been the case ever since early childhood. So maybe she'd be speaking as a teenager. Now, you make the claim in your book that girls who go online, who are searching for information about transgender identity, often encounter coaches who tell them to falsify their personal narrative and to claim that they've always been gender dysphoric despite the fact that that's not the case. Is that a reasonable summary of what you found?
Yes.
So you can see that it's a complete diagnostic mess from a therapist's perspective, and even from a conceptual perspective, because the people who are on the other side of the argument than you, let's say, are going to claim that the reason that these rates have skyrocketed to the point where they're at now is because there were always that many people who had gender dysphoria or who were transgender, but the weight of public opinion was held so strongly against them that they had to stay in the closet, essentially, and were unable to adopt their true identity. And the claim is going to be made as well that you're radically exaggerating the proportion of people who are putting themselves forward for transgender transition procedures, let's say, who have been coached.
Right. Okay. So let me respond to a few of those things. First of all, I don't think that's right. I think that, I mean, I agree with you that that's what they would say, but I've thought about that claim because, and here's what I would say in response. If this were just, as they say, a natural reversion, now that there's greater societal acceptance of transgender people, that they would say, oh, you would expect to see a natural reversion to what we're seeing now, which they might claim is a normal base rate of transgender identification in the population. The problem with that is, number one, we're only seeing this sudden spike among teenage girls. Where are the women in their 30s, 40s, 50s, and 60s who were denied the opportunity to come out as transgender? They should be coming out too, but they're not. It's the
and you
same
also
population.
point out, I guess the other thing that you might conclude is that if the bulk of the proportion of people who were claiming a transgender identity in the past were male, then release of the social strictures on identification should have produced an explosion in males. It's not easy to figure out why there is an explosion in females.
Right.
Okay, so that leads us to another extremely troublesome topic, which is why the explosion in teenage females. Now, you do attempt to explain that in your book, and so maybe you could outline for the listeners exactly what your conclusions were.
Sure. Teenage girls are famous for falling for every hysteria, right? We know that the way young women, and there are psychologists who've done wonderful work in this area, Amanda Rose is one of the University of Missouri, who I interviewed. Teenage girls tend to spread these psychic epidemics because their modes of friendship involve co-rumination, taking on their friend's pain. They like to rehash their own pain, and they like to take on their friend's pain. And they are even willing to suspend reality in order to sort of get on the team of their friend. Okay?
So would it be, I'm being a real son of a bitch in this interview to some degree, because I've been trying to think up all the objections I possibly could to your perspective because it's so contentious. And so I'm going to put forward things that I'm thinking about that are critiques. And it's not that I'm believing them, but they need to be brought forward. So a skeptic might say that you are relying on stereotypes of feminine behavior in adolescence to justify your claim that it's girls that are susceptible to a kind of hysteria, and that's an outdated and sexist, I suppose, hypothesis.
No, I'm not relying on stereotypes at all. I'm relying on evidence. If you look at the anorexia, it afflicts one population. If you look at bulimia, it afflicts one population, and it grows and it spreads among friend groups, just as this does. It's young women encouraging each other in self-harm. And if you look at cutting, same thing. And clinicians have known for years that you cannot house anorexics together in a hospital ward without being very careful, because they will encourage each other to lose more and more weight. We know that women
right, and you see that online with regards to anorexia, right, with the pro-ana sites and the pro-bulimia sites.
Right. It wasn't men who came up with thinspiration. Now, inspiration, right? Inspiration to lose more and more weight. It was young women. Now, of course, men get involved in all kinds of, bad behavior and encourage each other in all kinds of bad behavior. But this kind of socially spread self-harm has proven over and over to be endemic to young women.
You can't group antisocial males together when they're teenagers because they get worse. So that's well known. And in fact, if you take antisocial boys and you put them with pro-social boys, the pro-social boys become more antisocial. The antisocial boys don't get better. And that was discovered back in the 1930s in the Somerville study, the detrimental consequences of grouping antisocial boys together. It was the very large-scale study that was designed to, in principle, to reduce the risk of boys at risk for developing criminal behavior and alcoholism and so forth. It was one of the first longitudinal studies. It was a complete failure in that the treatment group, who were subject to all sorts of benevolent, at least in principle, benevolent interventions, did much worse than the control group. And after much painstaking analysis and heart-rending doubt, the study's authors concluded that housing the children together in the summer camps they had put out for them to get them out of the inner city was actually the cause of their increased pathology in adulthood. So it does happen among males. Now, Tumblr is also something that you discuss as a new mode of, perhaps a new medium of social contagion. And as far as I know, that's also a social media forum that's essentially female dominated. Is that correct?
I believe it is still, but though I am not, up to date on the latest, of who looks at Tumblr, but it always has been, yes, right. Predominantly female.
Right. So, all right. Here's another question. What made you convinced that you were qualified to do this? Because if I was a critic, again, I guess that's the next place that I would attack, right? Because you're not a mental health professional, and so it might be asked, what right do you have to investigate this even? That might be one question, but then also to draw conclusions.
Well, as I'm sure you saw, if when you read my book, I didn't draw any medical conclusions. That is, I relied entirely on experts. And I do believe it is a journalist's job to look into medical, phenomena, including epidemics and so forth, and investigate them and rely on the medical judgment of experts. And that is precisely what I have done. This isn't my, all I did was investigate a phenomenon with neither a particular hypothesis in mind, but just being willing to listen to a lot of experts. And it was their testimony and their explanation that I put into the book.
Do you think that you were even-handed in your selection of experts? I mean, because one of the ways that you can bias an outcome, obviously, if you have a political agenda, you can bias an outcome by selecting experts that testify in one direction. And of course, the transgender activists and perhaps the medical and psychological associations themselves might regard people like Ken Zucker as experts who, would appeal to someone of more conservative sensibilities, perhaps?
Well, sorry, I'm not. I think what you're saying is, did I bias it by only looking at certain kind of experts? And here's what I say: no, I didn't. If you read the book, I interviewed experts of all persuasions. But more importantly, there are literally thousands, I believe, certainly hundreds of books celebrating immediate medical transition for teenagers. There is precisely one book that did an investigation of the risks and benefits and concerns that might be had around the medicalization of teenage girls. That's it. One book. And the question is, so do all these experts have a voice? Of course. I don't claim to have done and conducted my own scientific study. All I did was show a willingness to speak to the experts who are very, very concerned about what's going on here.
Okay, so let's dig even a layer deeper, I suppose, is why the claim that you just made for example, that there is a very large literature supporting the idea of medical transition and a very small literature criticizing it is striking. I don't understand it. What's going on? Like, what's driving this? Why is it that the medical associations and the psychological associations have rushed so precipitously into gender identity affirmation when the cost of it, when it's taken to its logical conclusion, is extraordinarily invasive surgical modification, which carries substantive risk, and which I think it's fair to say has disputable benefits. Why is this happening?
Well, there are a number of reasons it's happening, but if you're asking why more doctors and therapists aren't speaking out, I think the answer is because if even Jordan Peterson is concerned about having this interview with me, and with all of your courage and all the stances you've taken, imagine what far less courageous doctors are willing to say.